Please tell us about the area of presentation chosen by you.
Yeah, so I think I've chosen two areas of presentation. One is on otolaryngology. The other one is in
Okay.
medical
And
technologies.
what relevance does this have with the summit topic? I mean, the summit talks mostly about the advances and innovations in healthcare. So could you please brief us on that?
Yeah. So on the otolaryngology presentation, I am talking about how innovations that are created in the West, even though are wonderful innovations and can reach a large amount of patients who will need it, but they still struggle to penetrate in India because they are invented for a completely different healthcare system. So I'm going to be talking about some of the reasons why those inventions are not doing very well in India, and then talk about my experiences with a few ENT inventions that I've invented over here in India, and how we have incorporated those factors right up front while we are inventing the devices. So essentially, to talk about how a process can be used into innovations, and doctors can use that process very well, and there are opportunities and recent advances in learning those processes that have started in India over the last 5, 6 years. So I would like to talk about that so that more clinicians who are there in the conference would know that they could also learn such processes and then invent for an Indian ecosystem so that
And when
devices
we
can
talk about
reach
these
a larger
innovations, sir,
population.
I mean, you're trying to touch upon why innovations and advances have not taken place in that amount in a country like India. So does cost also play a very important factor here? Affordability and cost?
I think cost is a big factor when we are trying to import innovations from abroad, but cost is not such a big factor when you want to invent in India. The only thing is there is no system to do innovations in India. Currently, it is nobody's responsibility to invent medical devices in India. There is no profession called medical device innovator, right? There's a doctor, there's an engineer, there's a designer. They're all doing their own things. If there could be a system where people can invent in India, then it will not be expensive to even develop devices and also not
So do
expensive
we have such
to
system in
sell them.
abroad? I mean, wherein they have dedicated team for developing devices?
Yes, there are a lot of processes and systems followed abroad over the last 10 or 15 years. And that's why there are a lot of doctors who are mostly the key innovators in the US or even in the Europe. And all these innovations are driven by doctors with a team of engineers and designers around them. So such kind of a culture is developing in India for the last 3 or 4 years, and those advances is
So
what I'm
this
talking about.
summit, it's one of its kind summit that we are going to conduct in the month of June. Could you please throw some light on what kind of learnings should the delegates and the participants draw from the entire summit? And how do you look forward to conducting such summits in India?
Well, one of the things is that it sounds like a great eye opener for the country to see that innovations is kept as the focus rather than subject areas. So that is very encouraging to know, and it is great to see that all the people who will be gathering there would be gathering with the focused area of innovations and advances. So just having everyone in one platform itself makes a huge difference because all like-minded people can then interact and a lot of ideas can spring out into a lot of new technologies. So that way, I think that the whole initiative is a great effort. Because I think one of the most difficult things is getting key people together, and I think such a large platform to do this would be groundbreaking. And if such more events are going to be organized in our country, then I would think that a lot of the rather than just having people talk about their experiences or talk about advances, we do workshops on innovation processes, and we also know other people who can help. So having something like that incorporated would be a way that I would see it go forward.
So in your Skype ID, I saw United States, which is why I was confused whether you're in India or you're in the US, which is why I asked about the timing. So why is it?
No, I think, yeah, I forgot to change it. I was in the US for some time, and I think I didn't update my location change.
So you were
So
there for your studies or for the
I'm in
research?
India. So I learned the innovation process in Stanford. So there is a Government of India program called Stanford India Biodesign, where the Department of Biotechnology funds 4 people from the country to learn the innovation process in medical devices in Stanford. So I did that in the year 2012 because Stanford has their own training program that they're having for the last 13 years. And this is the government's initiative to get doctors and engineers and designers to learn this
And it's
process.
so heartening to see that
I was there in the US for that
you've gone
purpose.
abroad and come back to your own country.